Good morning on this autumn solstice. I'm coming to you from my lounge and continuing the series around how to better manage type 1 diabetes. I'm dedicating this episode to all the parents who find themselves in the very tricky situation of having their precious child diagnosed with type 1 diabetes and having to, in a very short space of time, learn quite a lot on a very steep learning curve. So today, we are going to look at insulin sensitivity and carb ratio. And in a nutshell, the question we're answering is how much insulin to give at any given time. We're going to start by breathing. We're going to breathe either on a 4 in, hold for 4, 4 out, hold for 4. And what I want you to focus on is actually breathing into the back of your ribs. Most of us don't do this. And the deeper we can breathe, the more we can actually breathe into every single tiny little alveoli of our lungs, the more oxygen we get into our systems. And believe it or not, it actually makes a difference. And it makes a huge difference to one's brain. If one's well oxygenated, one's brain functions better. So that is the whole point of doing these little breathing exercises, is to open up the brain. So wherever you are, pause the video and do yourself a favor and do some breathing. Okay, so what is insulin sensitivity? Insulin sensitivity is how your cells respond to insulin. So you could have cells that are quite resistant and you require quite a lot of insulin to open them up to allow the glucose to go into the cell. Or you can have cells that are quite responsive and one requires less insulin to actually get those glucose molecules into the cell. The other concept we're looking at is carb to insulin ratio. In other words, the insulin you need to actually cover the carbs that you are now eating. So if we have a look at that plate, we've got 2 slices of bread. In this plate, I'm going to say we've got protein in the middle of that sandwich, and possibly some other form of carbs, because each slice of bread is 15 grams, so that's 30 grams on the bread, and we've got 15 grams for an apple, and then we've got some more carbs of milk in the glass. This mnemonic is adding that up to 60 grams of carbs. If your insulin to carb ratio is 1 unit for 15 grams, then you as the patient would require 4 units to cover this little scenario. Now, if you are brand new to this might sound like Greek, and a lot of learning around diabetes can sound like Greek. But what these videos aim to do is to try and break all of this Greek down into a language that is understandable and that helps you to help either your child or yourself to give the right amount. How much insulin does one require? I'm going to recap on a concept of basal versus bolus. If you see the squiggly line going kind of horizontally there, it's like a bluey green color. That is the basal insulin. Basal is the amount of insulin you require in the background to cover your basal needs. This is outside of eating, okay? Versus bolus, and I've made a whole little video just on basal and bolus. Versus bolus, that's the hoopy one in the red. That is the amount of insulin you require to cover a meal, or in some cases to do a correction dose. If the sugar is sitting at either 20 or 25 or HI, then you should do a correction dose, and you've got to work out how much of a correction dose am I going to give to bring the sugar back into range. The range I like to use for my patients it's a little bit broad. I like to use 4 to 10, anything between 4 and 10 millimoles of sugar, and I, as your doctor, am happy. Obviously, we can aim for a tighter range than that, but in the broad, that's kind of what I'm aiming for. So let's go back to insulin sensitivity. Okay. This is a little sort of animated diagram which helps you to try and understand how does the glucose molecule, which is represented by the purple sort of ellipse there, get into the cell. Every single cell in your body, brain, heart, eyes, kidneys, everything, skin even, requires glucose to do its metabolism. The only way it can get into the cell is the key. You see the little insulin is holding the key. The key is insulin. Okay, if you are resistant, like in the second little picture there, you're going to require more insulin to get that glucose into the cell. If you are sensitive, you are going to require less insulin to get the glucose into the cell. There are at least 42 factors. I'm not sure if you've seen the, I think it's the IDF that brought out this lovely poster with 42 factors that influence your sugar. But they also, those 42 factors also can influence your insulin sensitivity. And you can be more or less sensitive at different times of the day. In the broad, people are more resistant in the morning. Generally, require more insulin, so more insulin per grams of carbs in the morning versus the afternoon and the evening. This has got to do with a lot of factors, some of them hormonal, some of them circadian rhythm related. It's not, unfortunately, something we can apply to every single patient, though, because every single patient is different. Your insulin to carb ratio is how much insulin do you require to get 15 grams of carbs, one slice of bread, into your cells. So in the broad, it's often 1 unit for 15 grams of carbs. But if you are more sensitive or less sensitive, then that changes. When we're looking at labels, this is an example of a label. Every single food substance is required by law to have a label on it. And what you need to do is scroll down to where you see total carbohydrate content, and then obviously take note of the serving size that you are eating, because it will tell you on the top the size, the serving size, and then the information relates to that serving size. So if that serving size is a cup, for argument's sake, a cup of cooked rice or a cup of maize meal, either cooked or uncooked, you've got to also look at that. Then the amount of total carbohydrates will tell you how many carbohydrates in that serving size. That's what you've got to look at. So if you are 1 unit covers 15 grams of carbs and you're eating 1 serving of this unnamed brand of carbs, you will require 2 units of insulin. So to answer the question of what is your personal or your child's personal carb ratio, the best way I have found to do this is experimentally. So if you're on a continuous glucose device, it's much easier because you can see the sugar going into a meal. You can carb count it. You can work it out. You can work it out on 1 unit for 15. Or if you think you're quite resistant, 1 unit for 7.5 grams of carbs. Or if you're sensitive, 1 unit for 30 grams of carbs. And obviously any numbers in between. The maths can get very complicated. I try and teach people along the lines of 1 unit for 1 slice of bread, or 1 unit for half a slice of bread, or 1 unit for 2 slices of bread. And then you can translate this to other different common foods that you eat so that you don't have to do too much calculator maths. But at the end of the day, what you do is you look at your sugar going into the meal, you calculate, you give the dose, and then you look at the sugar 2 hours after the meal. If you are back to your starting sugar, you gave the right amount of insulin. If your sugar is higher, you did not give enough insulin. If your sugar is lower or you've had a low, you gave too much insulin. The important thing is the learning, not whether or not you got it right. What you're going to do with that information for the next meal. Use that learning and implement it in the next meal until the sugar you go into the meal with is the same as the sugar you're coming out of the meal with. You are going to have a meal rise in between, but we want it to come back into range. So one of the most common mistakes I see is that people think they can give their bolus at any time. They sometimes do it an hour before they eat. They sometimes do it an hour after they eat. They sometimes don't do a bolus. What you have got to do for your insulin dose to match your carbs that you're taking in is figure out what is the timing of your insulin. If you are on NovaRapid, Humalog, or Pidra, one really needs to dose this 20 to 30 minutes before you eat. If you don't do this, there is not a carb and insulin match because of the timing of how that insulin works. If you're on FIASP, you can inject your FIASP and eat your meal. FIASP is in the system within 5 minutes and it's out the system after 2 hours. It is easier to use FIASP, but some people either for some reason find FIASP too strong because they're used to other insulins and they're not sure of the timing, or for whatever reason, they prefer to use NovaRapid, Humalog, or Apidra. That's fine, as long as you're cognizant of what time to inject your insulin, understanding that it's going to take 20 to 30 minutes to get into your system, and then match it to the carbs. If you do the timing incorrectly, or if you try and bolus after you've eaten, especially with those 3 insulins, your sugars are not going to be in range. They're going to go high, and you're possibly going to get a low later because now the carbs are out your system and now the insulin starts to work. And people get very, very frustrated. Frustrated to the point of where they really want to stand on their head like this and scream and shout. I'm not asking you to do that. I'm asking you to take some deep breaths. And at the end of these videos, I like to give you a yoga pose to try and also take your time and relax so that you can integrate some of this information that has been shared. So this next yoga pose is much more doable than the one that's currently on the screen. And what I like about it is it possibly can be done by mom and dad or even mom and child. And if you take the time to, this is not actually that difficult to get into, especially if you let your little kiddie go underneath because they're usually much more flexible. And as a mom or a dad, you give yourself a bit of a breather and you do some breathing and you actually do some fun playing and games and just try and, enjoy the moment. And life can be very serious, and especially if you are dealing with type 1 diabetes, it can be very stressful. And I think it's important to take time to laugh, to breathe, to try and face this challenge in the best way that is possible. Unfortunately, type 1 diabetes doesn't have an off switch, and it's not going to go away until we find a cure, which obviously we are hoping to do. But for the moment, one day at a time.